Hey, Dr. Michael Bowman here, dual board certified facial plastic surgeon and ENT, coming to you with a 5-minute breakdown on salivary gland problems. Okay, so today we are going to be talking about problems with the salivary glands. This is sort of in the series of, oh no, I found a lump in my neck, what do I do? And we have multiple salivary glands in our face, and we're going to talk about the different things that can come about and cause problems there. So basically there's sort of 4 different types of salivary glands. We have the 2 biggest ones are our parotid glands located up here in our cheeks. The submandibular glands are located under the jawline here, and the sublingual glands are up underneath, basically in the floor of the mouth, under the tongue up front. Now in addition, we have hundreds of minor salivary glands that line the mouth and make small amounts of mucus, saliva as well. Now, the parotid glands are the biggest ones, and they make the majority of the saliva in our mouth. When those glands get inflamed or infected, you get a paratitis. Rarely this can be due to infections like mumps. Sometimes there's other things that can cause them to get infected, but most of the time a swollen parotid gland is due to a backup in saliva. Sometimes this can be due to a stone. Think of a kidney stone, and when it blocks off the flow of urine, it creates a lot of pain. Same thing happens in the saliva glands. This can also affect the submandibular glands. Either way, the treatment is usually pretty straightforward. So as a starting point, you're going to put some nice hot compresses on there, at least 3 or 4 times a day, but more often is better. Drinking plenty of water. We want to try to make that saliva as thin as possible. So if you're really dehydrated, that saliva is going to be more thick. It's going to be more prone to sludging up and not coming out of the gland and causing more backup. And then finally, eating something sour. Oftentimes people will tell you that this actually makes some of the discomfort worse initially, but it's what causes the saliva glands to contract, express all the saliva, push it out, and again, keep that backup from happening. So it might be a little uncomfortable at first, but it definitely helps out in the long run. You can use anything you want: sour candies, lemon juice, vinegar, pickle juice, anything that's sour kind of brings a little tartness to the mouth is fine. You don't need to chug, a gallon of vinegar to get this going. Just a little bit of part of a teaspoon is fine. A sip of lemonade, a little sour candy, any of those things work fine. But you're going to want to do that multiple times throughout the day to try to help keep that saliva flowing. Rarely these glands will get infected and require antibiotics. That's not true most of the time. But if you are seeing really just excruciating pain, you see redness and heat coming off of around your gland, fevers, all those things might be signs of an infection, and that's certainly something to warrant seeing a doctor for. Rarely, if the infections get severe, IV antibiotics can be necessary. Typically, we see that more in older patients that have more medical problems. We generally don't see stones and obstruction in the sublingual or the minor salivary glands, so we're not going to talk too much about those today. A few other things that can come up are tumors in the salivary gland. So if you notice a lump out here in your cheek, either behind the ear, extending anywhere up in this area, that could be a growth inside the salivary gland, the parotid gland. There are a bunch of lymph nodes that live in there, so it could just be some swelling on the lymph node due to an infection or another cause, but there are also tumors that can arise from the parotid gland itself. Most of these are benign. Of course, anywhere in the body there can be cancers, and there's a few types of tumors that can turn into cancers if ignored for long periods of time. Generally, if you do have a parotid tumor that's in the face, we're going to recommend that we get it out. There's definitely some, it's a delicate area, and you're going to want a very skilled surgeon to work on that. We won't delve too much into that at this point in time, but maybe for another video. So I think that's going to be about it for this video. We're going to try to keep it short, under 5 minutes, but please ask me if you have any questions down below, and thanks for watching. Hey, Thanks for watching this video. As always, this is meant to be general educational material and is not meant as specific medical advice for you or your family. If you have any concerns, please reach out to your doctor for appropriate medical advice. If you have any questions, please leave them down below and I'll answer them if at all possible. And if you're interested in making an appointment, please look down below for more information on how to do so. Thanks for watching.